It's time to get answers to your sports medicine questions on ESPN 700. This is the SportsMed Utah Doc Talk Show. This is your weekly chance to get real medical advice on your sports medicine issues from a sports medicine specialist from SportsMed Utah. Now, here's the host of Doc Talk, Hans Olsen, on ESPN 700.
All right, if you haven't heard Dr. Matthew Lyman, he's been on a couple times here on Doc Talk. He does a fantastic job. We're kind of focusing on hips, kind of lower extremities. I mean, we could do hips. If you got knee questions, some other things, we can get into that. So if you're dealing with hip pain, hip dysplasia, maybe you're dealing with some type of knee issue, knee pain, really any joint, we can get into that with Dr. Lyman.
It's kind of an interesting week for hips. Dennis Pitt did awesome on Monday with his comeback.
Yeah.
Second time back, but he did really well after his hip dislocation. That's amazing.
Yeah, he was. His initial comeback was even better. I mean, his initial comeback, I think he had 80 yards receiving, had a touchdown. It's just incredible. How do you come back from, honestly, when we first diagnosed that, Dr. Lyman, the beginning of the season.
They didn't know if he'd come back.
Yeah. We were thinking, could this be a career ender with a fracture on the femoral head? We were thinking, could this potentially end it?
It's a best case scenario. They excised that little fragment and put his hip back in, and he's done really well. I've seen other patients that haven't done well, but he's doing great.
How significant is that injury?
Yeah, it's very significant. And it can lead to avascular necrosis. And the femoral head can die and collapse, and then you have to have a hip replacement.
Wow. Is that something that he has to look at later in life?
Oh, yeah. Yeah, you're at risk for about 3 or 4 years. And the risk is significant. It's 30 or 40%.
Does that increase it by getting on the field as early as he has?
No, he's either going to get it or he's not,
Wow.
Bo Jackson got it. You remember Bo dislocated his hip and had to have a hip replacement a year and a half later, right?
Yeah, I wasn't aware that was the issue with Bo.
Yeah, well, they never really diagnosed a hip dislocation, but he said that his hip popped out, and then he said he popped it back in. It was never really clear whether his hip was dislocated. There was no X-ray showing that it was dislocated, but he later on had avascular necrosis. It was diagnosed a month after his injury, and so obviously he must have had a hip dislocation.
You're listening to Dr. Matthew Lyman of Davis Orthopedics and Sports Medicine. 877-353-0700. That's 877-353-0700. If you want to call the show and throw a question at Dr. Lyman if you're having any kind of hip issue. And, it cracks me up because we've got so many people. I know you're driving in your car right now, probably a construction worker somewhere. You're trying to be a tough guy. You're having hip pain. And you're just gritting this thing out because you don't want to go in and waste your time with the doctor in the doctor's office, having to engage with your insurance company, all those things that come with trying to diagnose a problem. Well, you can do it on air with Dr. Lyman. Get yourself started. Start right here on Doc Talk. 877-353-0700. That's 877-353-0700 to get on with Dr. Matthew Lyman. Doctor, you probably heard my dad just met up with Dr. Watson.
Yeah, I did. I saw his x-rays. So
you know what's crazy? So, of course, Dr. Watson, he's brilliant at what he does.
Yeah.
Brilliant at diagnosis, brilliant at in customer care. Mm-hmm. My dad fell in love with him, thinks he's like the greatest man to walk the earth.
Yeah.
He instantly diagnoses the issue, gives him an injection, and my dad is now going on a month and a half pain-free.
Yeah,
in that hip.
Injections work.
Zero pain.
Mm-hmm.
Now, what is that injection that's helped with that pain?
Steroid.
And does that just decrease the inflammation in the hip?
We do 2 medications. One's a numbing medicine, and that lasts a few hours. That tells us we got the medicine in the right place. But then there's a steroid that works to decrease inflammation and decrease pain, and it masks that pain. So the problem is still there, but he feels better.
Oh, he feels a lot better. So, I'm forever grateful. I nearly tear up thinking about it because he went for 3 years, could hardly get out of bed. But that's what I'm talking about. Those are our listeners. That's who I'm talking to right now.
Yeah, that's right.
There's a lot of people out there. You're too stubborn, people. Too stubborn. Take care of your bodies. You must be a popular man, Dr. Lyman, because we got banked lines. You ready to jump out to the phone lines?
I'm ready, yeah.
Did you know you were that popular?
No. Had no idea.
Yeah, that's pretty incredible.
It's probably just my family. They're all listening.
Couple balding men sitting here talking a little radio. That's what we do here, Dr. Lyman and I.
That's right.
We used to have hair. We now don't, but both of us have doctorates and degrees. All right, look, we have at least one doctorate between the two of us.
Yeah.
And I think that says a lot about who we are.
Yeah, I'll do the thinking, you do the talking.
There we go.
All right.
Let's jump out to the phone lines and go to Scott. Scott, you're up first with Dr. Lyman. Let's see if we can help you out a little bit. What's your question for the doc?
Hey, guys. How you doing tonight?
Good, man.
Good. Okay, my question, I have the dysplasia also. When I went to the doctor a couple of years ago, because I was having, felt like inner groin pain, but they had told me that there was a bunch of calcium and different things. It said it's probably from a lot of sports I played earlier, but I water ski a lot now, and I actually broke my hip. I tracked it last year water skiing, and so I was out for, there was a sixes whether they wanted to operate or not, and I chose not to, but the doctor told me that I can't run anymore. He thinks that running is one of the worst things for the hip. So my question to you is what's the best cardio you'd recommend, and what would you recommend to get it as strong as I can with the dysplasia and with the crack that I had in it from last year?
So you said you cracked your hip?
Yes.
Okay.
I tore my MCL and cracked my hip water skiing.
How old are you?
46.
Yeah. Yeah, I think the best cardio you can do is the stationary bike, elliptical, swimming, and those are my top three.
So is hiking one of those? It's got like a taboo thing like running?
No, I think that's good. Yeah, walking would be fine as well. Just low impact. All of those things.
Okay.
Is that for the
the
rest
running? The running is because of the running, the impact on your joints.
Yeah, that's right.
Is that for the rest of his life then, Doc? Or
Most likely, but there is an option for hips like yours for patients who are under the age of 55, and it's called a hip resurfacing. So instead of doing a hip replacement, a hip resurfacing allows you to resume running after your surgery.
Okay. I would rather just use the excuse if I can't run and do something else anyway at my age. So that would work for me.
Yeah, I'm with you.
so biking, elliptical, and swimming.
Yeah, and obviously the treadmill, walking, going hiking.
Okay.
That's a good option.
And then on the second part, is there exercises that you would recommend? Like I tore my rotator cuff in college, and they repaired it, but then they gave me a bunch of exercises to do that would really strengthen it up so that it would be a lot stronger in the long run. Is there some things I could do that could strengthen the hip or the joints or muscles around it?
Yeah, the rotator cuff of the hip is really those hip abductors, what we call the gluteus medius, gluteus minimus muscles, the external rotators. And so there are exercises that you can do to strengthen those, basically hip abduction exercises, which is difficult to tell you how to do on the radio. But if you go onto YouTube and type in hip exercises or hip abduction exercises, there's a bunch of them.
Thank you very much, and I appreciate you tolerating him.
Okay. Yeah.
Scotty has to bear it, man. That's okay. We have a blast here on Doc Talk. Appreciate the call. 877-353-0700. If you got a question for Dr. Lyman, that's 877-353-0700. Hips, knees, anything you got. If you want to throw an insult like Scott did, hey, feel free. I'm a big target. Take a shot at me, man. I'm a big man. I can handle it. I can handle the embarrassment. I don't know. You take a shot at Dr. Lyman, I'll find you. I'll hunt you down. I'll rip you out of your car, and I'll beat you about your face and shoulders. I swear it.
Thank you.
There you go. Protecting my doctor. Kyle, you're up next on Doc Talk here with Dr. Matthew Lyman. What's your question for the doc?
Yeah, I appreciate it. Thanks, man. Thanks, Doc. I've got a son. He's 17 years old, and he's an extremely good athlete. He plays football, he wrestles, and does track, long jump, high jump, javelin. He's just, multi-sport athlete. And he also did gymnastics as a kid. Just a great athlete. Key about it is he's been having problems with his hips lately. Last year, we took him in. The doctor said he tore his gluteus medius, and really put him on some not bed rest, but for him it was like bed rest, not being able to do anything. And he lost about 3 weeks during the wrestling season, to where he couldn't do anything to try and get those things, to solidify, heal up, and everything else. His coaches didn't like the doctor's note and tried to push him beyond, what he should do. And the problem is he got healed up. He kind of let things go. Everything's great. Did a good job in track season. Now it's back to wrestling season. They bothered him a bit this last football season. But right now in in wrestling, his hips are just killing him. They lock up on him sometimes to where he can't even stand up. And I just don't know what exercises. I heard a little bit while I was on hold that there's some exercises you can do to kind of strengthen those hips and the stabilize your muscles and whatnot. What would you recommend for a very active, very fit, 17-year-old kid who can, do just about anything, but those hips are just locking up on him, and
yeah. So he says they're popping and they're locking up on him, huh?
Yeah,
that's very concerning for what we call a labral tear. Most people are familiar with the knee and how you can have a meniscus tear that can cause your knee to pop and catch, right?
Yep.
Well, the hip has a labrum that works kind of like a gasket that helps keep fluid in the hip, and this labrum, when it gets torn, causes mostly groin pain. And they've studied that. About 95% of the time, it's groin pain. And,
in the adductor area?
No, I'm saying right in the groin. That's where the labrum would usually hurt. Is your son hurting in the groin or more on the lateral aspect outside of the hip?
It's more. It rotates across. When it locks up, he literally can't straighten his leg out. It stays in water position. So if you're familiar with wrestling, and I know Hans is, if you're in the referee's down position, and you're trying to come up from the down position, there have been some times that he can't even straighten his hip out.
Yeah,
and
wrestling
so
is
kind of locked there for a while.
Wrestling is a hip flexion intensive sport, just like hockey and the martial arts, soccer. We see a lot of these patients with labral tears, and probably your best bet is to see an orthopedic surgeon and possibly get an MRI.
So it does sound like a
labral tear. Yeah.
Is that something that will hamper this kid's future in sports?
Yeah. I mean, it sounds like he irritates it in wrestling, and that's probably going to hold him back in track if he doesn't get it taken care of.
Yeah, I mean, he's long jumping, over 20 feet, and he runs the 100 in about 11.2. Like I say, he's a good athlete, but when these things flare up, now I think you're up in the Davis area. Is that correct?
Yeah, that's right.
Okay, we live, in the Highland area, just in Utah County. Are there anybody that you feel comfortable with, so we wouldn't have to travel 40 miles? I mean, I'd love to come see you, but I didn't know if you had
the Jackson brothers. The Jackson brothers do this procedure. They could take good care of you.
You said, I'm sorry?
Jackson brothers?
Yeah.
Okay.
Are those the Jackson brothers that work with BYU football?
Mm-hmm.
Oh, okay.
Yeah, they do hip scopes as well.
Are they what hospital are they at?
I'm not sure.
Okay. Well, look up the Jackson brothers. I know them personally. They're good guys. I didn't realize that they'd worked specifically with those areas.
Yeah, they played. They were all state football, basketball players, all three of them, weren't they?
Yeah.
One of them's out of state now, Scott. He's on a mission president, but
I believe so.
The other two are there scoping hips.
Well, fantastic. Thanks, Hans, for the show. Thank you, Dr. Lightman. Appreciate it.
You bet.
And we'll look for him. Thank you so much.
Hey, good luck with that kid, Kyle. Man, that makes you worry. As a parent, to see your kid get injured at the age of 17 and feel like that's going to hamper him the rest of his life. So a labral tear in the hip, is that as quick a fix as a meniscus or an ACL in the knee? About a year, about 8 months, a year?
Yeah. I mean, you're probably looking at 8 months to return to a high level of sports.
And then once that's repaired, once he gets that labral tear repaired in that hip, he can get back to that high level like his dad was talking about.
He should.
Yeah, Kyle, hopefully you can get that fixed up. And, like Doc said, the Jackson brothers out there, give them a try. And you know what? It would be worth it. Look, if you know a doctor that, and obviously I back Dr. Watson and I back Dr. Lyman. They've both worked with my father. I've worked with Dr. Watson in the past. And I know these guys will treat you right. If you've got a doctor that you feel will treat your kid right, be the right choice for you, driving 40 miles, that's a very, very small sacrifice for your kids. So, maybe think that one through. All right, appreciate the call. 877-353-0700. We got open phone lines for Dr. Lyman. You got a problem? Knees, hips, shoulders. You got a problem in those joints, ligaments, tears. You feel some pain, some stiffness. You can't get rid of it. You're sitting in your car. You're miserable. Maybe it's just a nagging pain that you want it to go away. It's been around for a couple months. Give us a call. See if we can't get you headed in the right direction. 877-353-0700. More Doc Talk coming right up.